Goniometric measurement of shoulder internal rotation is performed supine on the mat with the shoulder abducted to 90 degrees and supported by a towel roll. You're going to first ask the patient to perform the motion. Can you rotate your arm down so that your toes point towards, your fingers point towards your toes? Okay, good. Now I'm going to squat down. My axis is going to be her olecranon process. My stationary arm is going to stay pointing perpendicular to the ceiling, and my movable arm is going to stay along the longitudinal axis of her ulna and follow her ulna as she moves. Go ahead and perform that motion for me. Okay, with this motion, we want to be sure to watch the scapula and the shoulder because there's a tendency for people to anteriorly tilt the scapula. So I'm going to push her back down just a little. Okay. All right. Okay, the norm for this motion is 0 to 70 degrees, and she is at 72 degrees. Substitution patterns for this motion are anterior tilt of the scapula. You can also measure this motion with the goniometer in a different position. In this technique, the olecranon process is still the axis, but the stationary arm is perpendicular to the floor. The movable arm is along the longitudinal axis of the ulna, and it will follow her ulna as she moves. Go ahead and rotate down again for me. Always be sure to double check position of the arms before you read the instrument. So this should be perpendicular to the floor. Is that as far as you want? Good. Be sure she's not tilting her scapula. Tuck her scapula back a little better. Okay. All right. So I have her she's currently at 75 degrees of internal rotation. You have to be careful when you use this technique because the goniometer reading is on the opposite side. So this is a technique you should practice a few times just to get used to doing that.